Well, COVID-19 vaccination efforts continuing today. Rhode Island and Massachusetts among the 36 states that began sending the first doses of the vaccine to some long-term care facilities. But the numbers aren't too impressive across the nation. 12 News reporter Logan Wilber live in Providence now with a closer look at the vaccination efforts here and why some other states are lagging. This is interesting, Logan.
Well, Erica, we're quickly learning that the fast development of this vaccine isn't translating to getting Americans vaccinated as quickly. Now, what this means is we are a long way off from the goal set of 20 million Americans being vaccinated by the end of the month.
Vaccine distribution began earlier this month for frontline healthcare workers across the country. The moment offered a glimmer of hope that the end of the pandemic was closer than anyone imagined. More welcomed news arrived this week as CVS Health began vaccination distribution on Monday to nursing homes and assisted living facilities in more than 36 states. In Rhode Island, this means distribution to 34,000 individuals living in settings hardest hit by the virus. More than 11 million vaccine doses have been distributed to states, according to CDC data. However, the same data suggests only 2.1 million vaccines have actually been administered. One of Rhode Island's top health professionals, Dr. ASHISH, says the pace has to pick up.
There's no doubt about it that things are going a little bit more slowly than we want. I think we need to really ramp up the vaccination, get the vaccines out to states, but then also get the vaccines from the states into people's arms. It's going more slowly than I think any of us would like.
Now, the Rhode Island Department of Health website has a full page dedicated to vaccinations. One thing of note on that page is there is no final decision made yet on who will get a vaccine and when. Those decisions will likely be made as more vaccines become available. Reporting in Providence, Logan Wilber, 12 News.
Now, Rhode Island's Department of Health set to give an update on the state's COVID-19 vaccination efforts. That's going to happen later today. Yesterday, Rhode Island and Massachusetts were among 36 states that began sending the first doses of the vaccine to some long-term care facilities. 12 News reporter Logan Wilber live in Providence now with a closer look at the vaccination efforts both here at home and across the country. Good morning, Logan.
Morning, Erica. Yeah, we're talking about more than 200 long-term care facilities now distributing vaccines to patients and workers. And while it was a massive effort to get the vaccine even developed as fast as it was, getting people vaccinated has taken a much longer time.
CVS Health began vaccine distribution on Monday to more than 36 states. In Rhode Island, nursing homes began the process of distributing the Pfizer vaccine to approximately 34,000 patients. The availability of the vaccine is welcomed news to congregate care facilities, which were some of the hardest hit settings throughout the pandemic. However, vaccine distribution is still far off of the goal set by Operation Warp Speed. Vaccines have only been administered to 2.1 million Americans so far, according to data from the Center for Disease Control and Prevention, falling short of the goal of 20 million vaccines administered by the end of the month set by the government. Vaccine distribution in Rhode Island nursing homes is a positive, but even people living and working in those settings aren't expected to receive the vaccine right away. At Berkshire Place, the initial doses of the vaccine were administered to 75% of the residents on Monday, according to Berkshire Administrator Kenneth Rotella.
Between 55 and 60% of our staff members are getting it. And it'll be done in 2 phases. I think after the second offering in a few weeks, anybody that wanted it in the facility will be able to get it. So very, very soon, probably in 2 or 3 weeks.
And Dr. ASHISH with Brown University says this entire vaccination process has to speed up, from the distribution to states and then from the states into people's arms. The entire process has to be faster. Reporting in Providence, Logan Wilber, 12 News.